Liz just asked me to say a few words about digital health, which is really a big and also emerging area that is intersecting with the global health agenda to quite a large extent. And we're just about to launch an MSc in global e-health, which considers health informatics with reference to global health challenges. It can be thought of really as working at the intersection of global public health, medicine, engineering, and global development. Many of the social scientists and economists working in ICT for development are also working on ICT for health, because health is one indicator of development and one driver of development. This all stems to a large extent from our engagement with the internet. The internet has gone global now. Until recently, when we talked about the internet, we were really talking about high-income countries. Other things got done on fixed computers. Some of those ended up in lower-income countries, but not many. And when they did, they were quite clunky. So, but things have moved on now. Networks have developed, and people are getting more access. And of course, many countries are moving up in the world and becoming high-income countries. And this is just a map of internet penetration from this year. And the ways in which we use digital resources are also changing. We're not simply just going online to find things. We're also not just looking at information, we're also connecting with one another, doing social things. Social network penetration's gone up. And importantly, we are also using mobile a great deal more. This is just one example of a country which has gone from there to here economically, China. And we see already the mobile internet penetration as 43% of the population. People spend a lot of time online, and they use it often in mobile forms. So traditionally, we were talking about people going to the internet. We still know that most people, including most doctors, according to some surveys, go to the internet, go to Google first when they're looking for health information. So, and this is expanding. It's not simply specialist websites with information, but it's also things like YouTube videos. Now we're looking at new forms of getting our health information that are very useful in areas where there's high illiteracy, for example. A smartphone which allows you to pull up a video showing you what to do or what not to do may be more helpful than a whole bunch of text on a page, or for that matter, a PC in a library. E-health is has been for some time an important topic for the World Health Organization. They have a strong e-health strategy. They publish policy reports and reviews each year about this. They have a global e-health observatory which looks at the progress of member states in terms of their access to digital technologies and their digital policies and infrastructures. That report there relates to their interest in the Millennium Development Goals, particularly for maternal and child health, and we're, Liz and I are working at the moment on a review for WHO on that. But likewise, there are some other concerns just now. The big distractor for WHO just now is the great land grab for high-level domain names on the internet. They're quite concerned that there will be many health-related domain names on the internet, that's your www. etc., will be grabbed by private providers, may give false and misleading information to the consumer. And this seems to be backed up by some studies that have been done recently looking at how people perceive those things. So WHO is quite concerned about that, and this represents another angle. But there are several things I could talk about, many aspects of health informatics. I won't. A big issue is around the large-scale infrastructures for health. Now we have large-scale internet systems, we have large-scale information infrastructures for connecting the NHS up, for example. That's hard enough. We know what happened with the National Programme for IT, which is the most expensive IT failure, supposedly, for ever, I think. Maybe the high-speed rail line might sort of usurp that status. But But nonetheless, we do have integrated health information infrastructures which allow us to connect up our health systems so we know what's going on. And this gives us strength. And in lower income countries, until now, this hasn't really been possible because not only were the digital, the underlying sort of the cabling and the networks and everything weren't there, the machines weren't there, the money wasn't there, but also the coordination wasn't there, the strategies weren't there. And this is a problem. But that's changing now, particularly with mobile networks. But the big thing here is connecting your institutions, generating that whole system data, strengthening your system. At the same time, the byproduct of all this is big data. Big data, we were hearing earlier, it's very much hyped as a term just now. Big data is everywhere. For research purposes, for understanding population health trends, for monitoring drug effects, etc., and for looking at things like epidemics, etc., public health, other public health issues. The bigger the data, the better is the theory, but it's all around the analytics that we use in order to extract the knowledge from that data. But certainly that's a big theme here and growing for lower income countries. But these national IT systems, as I said, are the vital backbone. And this just really shows here, this was a status report on some lower income countries, and they're used for different issues: health service, surveillance, patient monitoring, and registering of vital events. Really important that you capture that data digitally. It can be reused, it can be portable. One innovation that's been very successful and influential in lower income countries is Open MRS, Open Medical Record System, which is developed as a collaboration across many different providers in many different countries. And it's really, it's a tool for all sorts of data collection and management for strengthening health systems in a number of countries. And we have some links with that. The biggest, one of the biggest areas of research at the moment has been how we use the data that are captured by these large-scale information systems, but also in other types of e-health resources, like people's use of the internet, to generate pictures and get a sense of what's going on in terms of global health. This is a study just reported in February of this year, indicating that infectious diseases can be picked up very successfully by integrating a number of different digital resources, and this has speeded up the process by which we can understand where diseases are taking place and what's happening, which diseases they are, what their outcomes are. Geographic information systems are also digital resources. They were used very successfully for outbreak detection in the SARS epidemic, for example. This is a map produced in Hong Kong in the SARS epidemic, picking up data signals very, very quickly, giving us lots of opportunities. But again, many of the systems are not in place yet. That's another one. But as I said, there's some hubris evolving around big data. Some people believe that Google flu trends, for example, which was the great success story, is no longer actually predicting flu. They likened it to, I think it was a skateboard that the wheels were getting slowly and slowly looser on, and now it's got to the point when it's just too rickety to use, and we need further algorithms. But this is still attracting a great deal of attention, and certainly also Twitter mining. We're doing research with our PhD students on Twitter mining, Facebook mining, to get a sense of people's responses to different health issues and also their side effects of medications, for example. The other advantage of digital health is that it allows you to pull on a crowd, especially now that we have mobile and people also looking at internet at home on their computers. We're able to pull in information from all the different users out there, not just sophisticated medical professionals in organizations like national health systems. Pulling it out. And this has been regarded as an important adjunct to our other types of research. We can pull data from people's Google searches, as I've said. But it has other advantages too. Microfinancing through mobile phone micropayments has been advocated as a means of poverty alleviation. It is bringing people out of poverty, and as I mentioned, that's linked to health. It's also been used to crowdsource, in some cases, funding for health professionals in lower income countries where the resources just aren't available from the official health system. And there's quite a nice collaboration going on. I've just picked that image from the bottom from. It's been used also to incentivize the practice of care. This is a case from Pakistan, and they're using micro payments to doctors to incentivize TB data collection. So the doctors are paid if they can indicate that they have picked up a new case or they've treated it in a certain way. They get a micro payment on their phone. Likewise, patients who have TB are given urine strips and urine test strips. And when they are peed on, they produce a code. And they type in the code to their phone and they get a micropayment. Fantastic, really innovative. Just shows the sorts of clever things that can be done when needs must. And likewise, digital can also be useful for improving health governance, the sorts of problems that Sue mentioned just now, particularly around corruption and mismanagement. They are being used increasingly to point the finger at public officials who are not doing the job properly, who may be allowing people to skip the queue in a hospital because they get a little payment from someone, and the other people in the queue are now texting messages to a special site that will name and shame them, and this very quickly extinguishes this sort of behavior. And in fact, there's been quite a lot of attention on this recently, and again, Liz and I are also doing another project for USAID looking at this sort of issue in relation to mHealth, mobile health, which I come to now, which is, as I mentioned, e-health as we know it is very much the internet and machines and satellites and cable. But in developing countries, it's flipped or leapfrogged straight to mobile, and now suddenly all of that stuff's becoming available, but they're doing it through wireless. And the advantages obviously are that they can be very inexpensive, very portable. There have been tremendous leaps forward because people have had basic, not even smartphones, basic phones in poor countries. Likewise, mobile devices like PDAs, hugely useful for testing people in the field, for doing surveillance, for other kinds of health monitoring, etc. And lots of research around that. Increasingly point-of-care diagnostics, which are shrinking and shrinking and shrinking, and being linked to your mobile phone. So pretty much you have a lab in your back pocket. Some of the iPhones now are doing this, are monitoring very successfully, but of course and of course the Gates Foundation sponsored a big round of new research to develop these small, cheap, portable diagnostic tools, I think last year or the year before, which actually produced some good outcomes. And for infectious diseases, mobile is used a lot, not only for health surveillance, so professionals being able to type in that they've seen a case here or a case there, or people saying that, you know, themselves as communities that they've done it, but also for self-management. And the biggest area in this is HIV treatment and prevention. That's probably the main area in which there's been research on mobile for infectious diseases. This literature review just came out last year, really saying, yes, there's been a lot of good work, but we still are short on evidence in this area. So more work needed, and we're certainly keen to do some more evaluative work in this area. But the sort of things that they're used for most commonly are appointment reminders and medication reminders. Take your antiretroviral medications, and been quite successful for that. But also moving into things like abstinence, messaging for prevention as well, and messaging about condom use, that sort of thing. Most attention, though, in Europe around mobile is self-care on the move, so really managing yourself. And the priority for us has been long-term condition management and diseases of the elderly, not so much infectious diseases, which pretty much hasn't been on the agenda in Europe at all. Of course, it's still a dominant issue in other countries, and we've done some work in this area too. I just want to sort of think out the box for a couple of minutes. So we know that there is now a move in the whole digital health space towards apps. We have medical apps on our phones. They're able to do all sorts of things, but also gaming. So we incentivize each other by gaming. But there's also some interesting things about gaming. And this was a nice story I came across about the World of Warcraft. And the World of Warcraft can generate a plague, which is an infectious disease. And people were quite surprised by how it did this. People had been wrestling with the fact that it was very hard to understand sometimes the, I'm no expert on infectious disease epidemiology, but the way in which diseases change and sometimes infect populations in unexpected ways. And so these researchers that I'd heard them speak at the World of Health IT thought that would be quite an interesting thing to think, well, can that be simulated in cyberspace? And also can games that happen in cyberspace, because human beings are involved, somehow be a little bit better than computer algorithms in predicting how these diseases evolve over time? And so they had a look at this, and the upshot was they looked at the way in which the game had infected people. It was much more realistic than a computer-based simulation had been. And they were suggesting that, well, much the same as the games administrators managed to cure the game, cure this epidemic with this spell that they had worked up, could we maybe learn from that? And I know that's a little bit facetious, but the point is there is some quite interesting innovation that brings together the digital, the mathematical, and the social. And this can sometimes create some quite interesting things, and we should at least be mindful of it. And just a plug for our MSc course there, and I'll stop there. So thank you.